Imagine waking up one day, feeling a slight twinge of discomfort. You brush it off, but as the weeks pass, the discomfort grows. Eventually, you're sitting in a doctor's office, and the words you never expected to hear are spoken: you have cancer. For many, this is a life-changing moment. But today, the landscape of cancer treatment is evolving faster than ever before, giving us hope that we can turn these moments of despair into stories of survival. The traditional approach to treating cancer, chemotherapy and radiation, has saved countless lives, but it's also notorious for its harsh side effects. These treatments target not just the cancer cells but all rapidly dividing cells, often leading to hair loss, nausea, and fatigue. However, in recent years, something remarkable has been happening in the world of oncology. A new frontier has emerged, one that doesn't just attack the cancer, but teaches the body to fight back. This is the story of immunotherapy. Imagine your immune system as an army of soldiers, constantly patrolling your body, on the lookout for invaders like bacteria and viruses. It's powerful, but here's the catch: cancer is like a master of disguise. It blends in, tricking your immune system into thinking it's harmless. Immunotherapy changes the game. It unmasks the cancer cells, revealing them for the enemies they truly are, and empowers your immune system to attack them. One of the most revolutionary forms of immunotherapy is called checkpoint inhibitors. Normally, our immune cells have checkpoints, proteins that act like brakes, preventing them from attacking healthy cells. Cancer, however, can hijack these checkpoints, using them as shields to protect itself. Checkpoint inhibitors work by disabling these shields, allowing the immune system to attack cancer with full force. It's like removing the brakes from a speeding car. The immune system goes into overdrive, hunting down the cancer cells. Take the case of pembrolizumab, a checkpoint inhibitor that's been making waves in the treatment of advanced melanoma, a deadly form of skin cancer. Patients who once had little hope are now living years longer, with some even seeing their tumors disappear entirely. This isn't just a small victory, it's a major turning point in cancer treatment. But that's not where the story ends. The future of cancer treatment is getting even more personal. Imagine if we could design a treatment that's tailor-made for your body. Enter CAR T-cell therapy, a form of immunotherapy that does just that. In this treatment, doctors take a patient's own immune cells, genetically modify them to recognize cancer, and then reintroduce them into the body. These supercharged immune cells become relentless cancer hunters, tracking down and destroying tumors that were once invisible. The results have been astonishing. In cases of certain types of leukemia and lymphoma, CAR T therapy has led to complete remissions in patients who had exhausted all other treatment options. These aren't just statistics, they're lives being saved, families being given more time together. But perhaps one of the most exciting developments on the horizon is the potential for cancer vaccines. While we typically think of vaccines as something to prevent diseases like measles or the flu, researchers are now developing vaccines that can prevent or even treat cancer. These vaccines work by training the immune system to recognize cancer cells early on, stopping the disease before it has a chance to take hold. While still in experimental stages, cancer vaccines offer a glimpse of a future where we could prevent cancer just like we prevent infectious diseases. So, what can you take away from all this? Immunotherapy is no longer a distant dream, it's here, and it's changing lives. We're standing at the edge of a medical revolution, one where cancer might no longer be a death sentence, but a disease we can control, and maybe even cure. Now, if you're wondering, what can I do today? Here's a tip: stay informed. Ask your doctor about the latest immunotherapies and clinical trials. Many cutting-edge treatments are becoming more widely available. And remember, this is just the beginning. Every day, researchers are making strides, and the hope is that in the near future, cancer will be a story of survival for everyone. Thank you for joining me today. Stay curious, stay hopeful, and most importantly, stay healthy.